Hi, everyone, and welcome to the Muslim Sex Podcast. Thank you so much for tuning in. I really appreciate your patronage, and I would love it if you could leave me a 5-star review because that really helps me. And if you could like and share this episode with somebody that you know that may benefit, your friend, your colleague, anyone, I'd really love you to share this podcast, especially if you find value in the Muslim Sex Podcast. Also, I'd love for you to subscribe to my YouTube channel and follow me on all my social media. Also, as you probably know, if you've been listening to this podcast, is that I have a practice that is now open in Chappaqua, New York. I see patients for menopause and sexual health, as well as regular gynecology. So if you are looking for a gynecologist that actually spends time with you, that has time to listen to you, then I would invite you to come and see me in my practice, and I'd be more than happy to take care of you. So make sure if you live in the New York area, or even if you don't, come and see me in my office. I'd love to meet you. And also, last but not least, is that I am hosting again my retreat in Morocco for 2025. So if you are looking for a gift for a family member, a friend, yourself, make sure you take a look at our retreat, the Love and Nourish Retreat. It will be held September 19th through the 26th, 2025. Again, this year in Morocco, we will be visiting the same towns. We will be in Marrakesh and Essaouira. And as always, we will be providing information and lectures on menopause, perimenopause, nutrition, and also going for cooking classes as well as excursions. So don't miss out. I know a lot of people were sad when they missed out this past year on the Morocco retreat. So make sure that you go and visit the Love and Nourish Retreat hosted by Caria Retreats. And now onto the episode. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodi, and this episode is everything you need to know about being Southeast Asian and going through perimenopause, menopause, and kind of what that means for you if you are of Southeast Asian descent, and what are the risk factors, what are the things that we have to be aware of, heart disease, osteoporosis, bone density, all of that good stuff, diabetes, all of that. So we're going to get into that today. But before I get into the episode itself, remember, this is not meant to be any type of medical advice. If you have any questions about your heart health, your bone health, your cholesterol, any of that stuff, make sure you go speak with your healthcare provider, because they are going to be the ones to work with you to help manage all of that stuff. And of course, it's not meant to be any type of religious advice. So if you have any questions about your religion, go speak to your friendly neighborhood religious leader. And this is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. But on this episode, it's really going to be focused on perimenopause and menopause. So just to kind of get us going, remember what I'm going to go through, just kind of what perimenopause is and what menopause is, and just start with those basics first, right? So perimenopause, we know, is the transitional phase, right? So it's the time where some people call it like puberty in reverse, but it's a time where our hormones are fluctuating, and it's that big chunk of time before we go to menopause. And menopause, we know, is that one day that we go a whole year without a period, right? So you're in perimenopause all the time before that. And once you don't have a period for a whole year, now you're in that phase called postmenopause. So that's what that is. And we know in perimenopause, we know that the estrogen is going up and down, kind of like a roller coaster, right? And that change in when your estrogen is really high to when the estrogen is low, that delta is what causes perhaps our mood swings and our emotional ability, the anxiety, the depression, all of that happens during that time of perimenopause. And of course, anxiety and depression, we know a third of the people that develop anxiety and depression can develop it in perimenopause, even those that have never had it before. can develop it in perimenopause, right? Due to that estrogen fluctuation. We also know during this time that progesterone also starts to go down, not in kind of like that roller coaster fashion, but it starts to go down. And we know that as we approach menopause, it'll become very low. And we also know that testosterone goes down. So testosterone also steadily goes down in perimenopause, and then, of course, also in menopause. And all of these hormones are produced in the ovary. And we know that, once the ovarian function shuts down, then these hormones really become, especially the estrogen, really can become non-existent. And that's why we get all these symptoms of, that decreased libido because that testosterone goes down, that sleep, right, is totally affected in perimenopause, menopause, and that's a function of the progesterone. And, estrogen we know is protective, is anti-inflammatory, and helps with so many functions in our body. We have estrogen receptors from our head to our toe. So we know that estrogen is protective. It helps with our bones. It helps with our mood. It helps with our cognition. It helps with so much stuff, right? Prevent that genitourinary syndrome of menopause that I did a whole podcast on. If you don't remember it, go back, take a listen. The American Urologic Association just published new guidelines on that. So that's really important for you to know and understand. But anyway, so let's go on. Let's continue. So perimenopause, we know, is this time of hormonal fluctuation, and it's really important to understand and know what's going on. It's really important to understand also, right? We have most of our data, right? We know that women were not included in research until 1993. And we know that most of the research that has been done on women has been done on Caucasian women. So research on Southeast Asians is few and far between. But there has been a little bit of research that has been done. There is a study an ongoing study called the Masala study. So we know that the Masala study is an observational cohort study of the incidence of risk factors for cardiovascular disease among women and men. So it includes both of South Asian descent residing in the U.S. So that's why it's different, because it specifically looks at individuals from the Southeast Asian diaspora here in the U.S. It started out with UCSF and also through Northwestern University, and now they've included NYU in this study as well. So it looks at specifically the incidence of cardiovascular disease in Southeast Asians. We know that Southeast Asians have, as my older son would like to say, we have really bad genetics. And it is true. When he first said that to me, I was like, what the heck is he talking about? But it really is true. We do have bad genetics. But it's okay. We can figure that out. And, as I was doing my research on this podcast episode, I was listening to a webinar from one of the researchers of the Masala study. And she said that really, she would say that about 10 to 15% of our risk factors for cardiovascular disease among Southeast Asians is biological or genetic. So we have a huge opportunity to be able to change our trajectory for heart disease by incorporating, a healthful diet, incorporating exercise, getting yearly checkups and all of that. So we'll get into that. But I do want to mention what exactly that Masala study was. Okay, so it's important to understand that, perimenopause, menopause in Southeast Asian women is crucial to understand this phase of life because of what we know now, which is that, 30 and 40% of women will spend their lives in postmenopause, right? And we know in postmenopause, we start to see the development of chronic disease. For example, women, start to become pre-diabetic. They can even become diabetic. Women start to have a high cholesterol. We know that heart disease also starts, and that beginning of that chronic disease starts in, that perimenopause and within that first 10 years of menopause. And so that's why it's really critical if women decide to go on estrogen, to go on it within that time frame to really help out we know that, okay, so just to kind of backtrack a little bit, we know that the WHI studies show that, estrogen, we don't use estrogen to help with cardiovascular disease. However, we know that estrogen is anti-inflammatory and it's going to prevent the cardiovascular disease from progressing, right? We also know that because of its anti-inflammatory properties, estrogen is going to prevent that stiffening of the arteries, and it will be helpful, right? But we don't use hormones to prevent cardiovascular disease, is what I'm trying to say. And I want everyone to understand that we don't, estrogen is not used for that indication. Estrogen hormones are used for to prevent the vasomotor symptoms, the hot flashes, the night sweats, and to prevent osteoporosis. That's what we use estrogen for. But there are other benefits to it. Okay, so let's go on. So what is that kind of that mean age of menopause? So if we're saying that there's, a little bit of distinction between Southeast Asians and, let's say their Caucasian counterparts, right? Like, what is that difference? So we know that the mean age for a woman to go through menopause here in the United States is between 51 and 52. We are finding out that for Southeast Asians, it's actually earlier. And so there was a systematic review that was done in India that noted that the age of natural menopause was around 46.6 years. Okay, in Pakistan, there was a study that was done and they found out that mean age for menopause for someone living there was about 47. In the United Kingdom, they also, did that study, and there was data on South Asian women that lived in the UK. And even though that data is limited, they noted that it appeared to be between 49 and 51. Well, here, through the information from that Masala study, there was actually a study that was done, and I'm so excited about the study because I didn't even know that it existed till I went down the rabbit hole of doing research on this podcast episode, that there was an article that was published in the journal Climacteric, and it was an original article which focused on experience of hot flashes, urinary incontinence, and mood among South Asian American women. And they took data from the Masala study, and it was published just this year, March 2025. So it's very, very recent. And I'm going to talk a little bit about the study because a lot of my information that I received or that I took for this podcast was from this study, and it is an amazing study because they took some of the limited research that we have, but they used the Masala study to extrapolate information on menopause for women in Southeast Asians and kind of what's going on there. So in that study, what they noted was that that U.S. women of South Asian descent had and showed that they experienced natural menopause around the age of 48 and 49 years. Okay, so somewhere around there, between 48 and 49 years. The reason why this is important, right, is that we know that the perimenopause time occurs before menopause. So really, this discussion about menopause for Southeast Asian women should be happening in their early 40s, maybe even in their 30s, right? Because they really need to know what's happening. And if they happen to go through menopause during that time, between when they're 48 and 49, they need to know what to expect and what are the things that they really need to focus on. Okay. So the study found that women that were here living in the US, a lot of them, so they relied on, so this Masala study also relied on recall information. And sometimes we know that we don't always remember things the way that they were, or, when something happened, right? So it says, age at menopause may have been underestimated as some women might incorrectly report it as age at the last period, as opposed to medical definition of age corresponding to 12 months after the last period, right? So sometimes we're not sure if the patients always understand the questions that's being asked to them. So there could be some recall bias, or maybe they don't remember, so that could be part of the problem of this study, but it is important to understand that Southeast Asian women, and that's, also found with other studies, right? So I just mentioned that in India, a systematic review found that, women that were Indian in India experienced menopause around the age of 46, women in Pakistan around the age of 47. And so what they're saying here through this Masala study of Southeast Asian women here in the United States, they're experiencing menopause around 48, 49. This is important because we know that the genetics of Southeast Asian women, right? We have an increased propensity to gain weight. We have an increased likelihood of becoming diabetic, of heart disease, all of these things. And we know that these things also follow us into menopause, right? So we have twice the risk almost of having the heart disease because we already, through genetics and also maybe through our food and diet and perhaps sedentary lifestyle, right? We have this increased risk even before menopause. And now in menopause, we know that due to the decline of estrogen, we have these, increased likelihood of high cholesterol, of diabetes, of heart disease already just from the loss of estrogen, right? So now you compound that with being Southeast Asian, and our risk factor goes up for heart disease and this cardiometabolic syndrome that is present for Southeast Asians. But I feel that gets even more magnified for women that are in menopause. So let's talk a little bit more about this. Okay, so this study, like we know, it said that, right, most women noted that it was between the ages of 48 and 49. So, right, so that's 3 years. So if we're saying that somebody here in the US goes through it at age 51, 52, so it's about 3 years before a Caucasian counterpart goes through menopause, right? And we also know from the Masala study that it provides new data that women of Southeast Asian ancestry have a substantially different menopause experience to the US women. And that was through this study that I just mentioned, the one that came out in March. Okay, so we know from that study, we know that Southeast Asian women experience menopause differently and than other racial and ethnic groups here in the US. Also, we know from the Masala study that the Southeast Asian cohort is the fastest growing ethnicity here in the United States. So the majority of women in that study tended to experience menopause. 93% of them experienced natural menopause, and about 30% reported earlier or premature menopause, which is a very high number, right? Compared to less than 6% of white and Black US women and less than 7% of Hispanic women. So when we talk about premature menopause, right? So we are talking about premature ovarian insufficiency, which is typically defined as less than the age of 40. And so that's really important to understand that if women are going through menopause earlier, then they have the burden of disease that they carry is, much longer, right? So when they no longer have that estrogen. And that is something that is really, really important for Southeast Asian women to understand. We know that, so given the fact that if women are starting menopause at around 48, 49, then for them, for the Southeast Asians, we know that maybe perhaps they are starting perimenopause even earlier, right? So it could be, not only in their early 40s, but maybe even in their late 30s for this subset. And that's really important to understand for practitioners because we want to be able to, make sure that we understand and we don't dismiss the symptoms that these women come in with, right? Maybe they're having hot flashes or night sweats, or maybe they're having these mood swings. Maybe they're having joint pain. Maybe they're having heart palpitations. Maybe they're having this increased weight gain. And if we don't understand that these women tend to go through menopause much earlier and their perimenopausal symptoms may be starting earlier than their, Caucasian counterparts, then we may not really take them seriously. So that's why that's really important to know and to understand. Factors that can influence perhaps the earlier menopause in South Asian women. It could be socioeconomic status. Maybe in India, we know that it started around, right, menopause, the mean age over in India, based on the systemic review, was 46 years old. So it could be possibly to lower socioeconomic conditions that have been associated with earlier menopause. It could be a link between poverty and earlier age, lifestyle factors. It could be diet. We know, at least I know, that when I went to Pakistan just last year, I didn't see too many women going out to the gym and working out and exercise. It's, and that may be changing, and I'm really excited and hopeful if that is changing. But I know that, exercise is almost like a luxury, right? You really have to have the time and the money to be able to exercise, because not, there aren't gym, like it's not like here where there's like gyms at every corner, and for every pocketbook, right? Like everyone is able to, you can get a gym membership for $10 a month, right? In some places, it's not like that. It's, usually those are few and far between in terms of trying to find gyms for women. And then, the cost, I'm sure, is also probably very expensive. And usually it's those that are able to afford it, right? That money is not an issue, that are able to go. So, physical activity has a lot to do with, when someone may experience menopause in either in India or in Pakistan. The reproductive history can obviously influence menopausal timing as well. They noted that higher rates of female sterilization at younger ages in certain Indian states have been associated with earlier menopause. And that makes sense, right? Say for whatever reason, if a woman had a hysterectomy, if they had taken out the ovaries at the time of surgery, then that woman went to surgical menopause. And, depending on how old she was, right, she may be experiencing, definitely with surgical menopause, you experience those vasomotor symptoms more intensely. And it happens right away. It happens, right when they basically wake up from the anesthesia in the OR. So it's really important to know and understand, what's going on, and why are some women experiencing earlier menopause than others. Also, we have, because exercise is not, and really, I don't want to speak for a country, right? Like, so not everyone is, the same. So I don't want to say that exercise is not a priority, but at least what I can say is that from what I have seen in my experience, exercise was not a priority in a lot of the communities that I saw. And so, we have the sedentary lifestyle, we have the central obesity, which also leads to, cardiovascular disease, and we already have the genetics for it, right? So it just compounds the problem. And that can also affect, perhaps some of that menopausal timing. So what are the common symptoms? So what are the things that a lot of women will experience? So, from that study that I just talked about, I'll tell you about the three most common things that they noted in the postmenopausal women. But, the symptoms are similar, right? So a lot of women will come in with joint pain, with muscle aches, with hot flashes, with the night sweats. They'll also describe fatigue and mood changes and weight changes and sleep disturbances, right? So it's similar to what a lot of women experience in perimenopause. Also, of course, you can have the mood swings, the irritability, the anxiety, of course, are all very common. And it's common in most women that experience perimenopause. I'll tell you a little story about myself. So I started to have these panic attacks in my 40s. Okay, so we'd be out like on a family vacation, and I distinctly remember when we were. So I was lucky enough to go to the Vatican, and we were in the Vatican, and we were going on a tour, and and it was like St. Peter's Basilica. And, there's a lot of people there, right? There's like a huge crowd. Some of the, pathways are narrow, and, and it's hot, there's a lot of people around. And as you can probably see, like my anxiety was like building and building and building. And all of a sudden I had a full on panic attack in the middle of this tour. And it was absolutely awful. And I was like, I felt like I was going to like pass out. I thought like, oh my goodness, I need to get out of here right now. And so I, I started to go backwards. The tour is going forward and I'm trying to go back and trying to like, make my way through this swarm of people trying to, just follow the guide. And I'm going the opposite way. And then I get stopped by one of the security people and they ask me like, what the heck am I doing? And I tell them that I'm having this panic attack and I need to just get out because I was feeling claustrophobic and it was just awful. And, I'd love to say that that only happened to me once. It's happened multiple times. And of course, I know I'm claustrophobic. And so this anxiety that happens and these panic attacks that happen in perimenopause are like no joke. They will disrupt your life. They will it's a problem. And so I really will say that recently I was in another situation where there was tons of people and, I got crowded and stuff like that. And I looked at my son and I said, he's like, oh no, are you starting to feel claustrophobic? And I said, no, I feel like my estrogen is helping me. So there is hope. I just want you to know. But, I just wanted to tell that story about like anxiety and, these panic attacks that start to happen in perimenopause. I mean, it's a real thing and it can be very disruptive to your family, to your life and all of that stuff. Anyway, so let's continue. So we were talking about mood swings, anxiety, irritability, all of that stuff happens and, can happen for anyone, right? And these are similar things that happen to, of course, Southeast Asian women as well. So here's the thing though, right? So when they did this study, the one that I'm talking to you about, the one that just came out in March, on March 11th of 2025, they talked about the common menopausal symptoms that they noted in these women. And this is all, of course, data that they got from the Masala study. And what they noted was that vasomotor, urinary, and mood disturbances were the three most common symptoms that they noted in these menopausal women, right? So the vasomotor symptoms tended to stay. So again, those vasomotor symptoms are like the hot flashes, the night sweats, the mood swings, all of that. Not the mood swings, sorry, but it's vasomotor symptoms are the hot flashes and the night sweats. And approximately 46% of women in perimenopause and in early postmenopause, with nearly half of those indicating at least moderately bothersome symptoms. So they're just basically telling you that 46% of women of Southeast Asian descent experienced vasomotor symptoms. And, it tended to last. It was more than just in perimenopause. It was also into their early postmenopausal years. And that, they described them as being moderately bothersome, right? Also in this study, they found that 9% of women in perimenopause and early menopause had anger symptoms, while 12% reported anxiety and depressive symptoms. They also noted that 37% of perimenopausal or postmenopausal women had urinary incontinence, and suggested that Southeast Asian US women have the highest prevalence of urinary incontinence among any US ethnic minority. And I thought that was absolutely fascinating. I mean, I don't know why that is. I could say it's genetics again, which I don't want to say. So I don't think it's that. I think that, I'm curious to find out why that is, right? Why do we have more urinary incontinence than any other ethnic group in the US? I would like to say that I think it has a lot to do with education, right? So maybe women are having these symptoms and really not understanding that there's treatment for that, right? Maybe they think it's a function of just aging and that's just the way it is. And so they don't seek out the help. And I think that could be definitely one of the reasons why we see that. And also I think that not a lot of women, right? And I'm not only like just Southeast Asian women, but I think not a lot of women know of pelvic floor therapy and know how life-changing that can be and how to really understand your muscles in the pelvic floor and the pelvic diaphragm and how they work. So I think a lot of it perhaps has to do with education. Of course, there's also stigma and taboo talking about these things, right? Women may not feel comfortable talking to their doctor about those kind of things, and they may also think that perhaps they heard somebody say that happens later on in life, and it's just something they have to deal with, and so. For me, in my head, I'm thinking that perhaps it could do, it has to do with, the culture, the stigma, the education. I think all of that. Um, we also know that the earlier age of menopause influences cardiometabolic morbidity, which is what I was talking about a little bit and alluding to in the beginning. Also, it influences depression and anxiety and lower bone density and impaired cognitive function, which definitely can impact health disparities in older women. We know with cardiovascular risk, right? So the decline, so just in general, right? We know that in postmenopause, there are a decline in estrogen levels, right? So we know in perimenopause, it's kind of like that roller coaster, but after you no longer have a period, that estrogen decline is pretty steep. So the decline in estrogen levels postmenopausal can definitely increase the risk of heart disease. And we know that just in the general population, but for Southeast Asian women who already have a higher predisposition to cardiovascular conditions, this becomes a significant concern, right? We know this is like a big problem. Southeast Asian women may experience changes in blood pressure and cholesterol levels during perimenopause, increasing their cardiovascular risk. Okay. We also know that that this cardiovascular disease for Southeast Asians can actually happen at a younger age compared to ethnic groups, right? So that is something that is really important to understand. The Masala study highlighted that South Asians have higher levels of coronary artery calcium, which is a marker of atherosclerosis. So atherosclerosis is like the buildup of plaque in our arteries, right? And so Southeast Asians have these higher levels of these calcium scores, and that correlates to an increase in cardiovascular risk. Also, we know that high cholesterol, right, dyslipidemia, so elevated Southeast Asians also have elevated levels of lipoprotein A, which is a type of cholesterol associated with heart disease, and of course is more common among, you guessed it, Southeast Asians. So this lipid abnormality contributes to the heightened cardiovascular risk observed in this group. Okay, so along with all the other stuff, right, we have to really understand that our risk of cardiovascular disease is much higher than our Caucasian counterparts. And so that really behooves us to really watch our diets, go for our annual exams, go and get our cholesterol checked. I guess if you have to go on statins, I mean, I was told by my doctor that, of course, I have high cholesterol, but I'm going to get it rechecked. So I'll let you guys know what it is now. Hopefully it'll go down. But I am doing flaxseed. They say that helps. I'm not sure. But anyway, so they say statins help, right, with lowering that cholesterol. And if it means preventing a heart attack, that's what we're all about, right? We don't want to have any of these horrible problems that can happen, right? Stroke, heart attack, any of those things. So really important to make sure that you're following up with your primary care doctor, especially because of the increased risk of cardiovascular disease, not only from our genetics, from our lifestyle. And here I feel like in the US, I feel that South Asians are more into exercise and gyms and things like that. I feel that we are a little bit more aware of health factor risks. And I think just understanding that we are more at risk for cardiovascular disease really pushes us in trying to mitigate that risk, right? So whether it's with diet and exercise, I think that those are, the most important things. Also remember that in postmenopause, right, we have, for women that undergo early menopause, right? So we are talking about Southeast Asian women going through post or menopause earlier, right? So at 46, 47, 48, 49, so that's definitely earlier than the general population. So we are going longer without estrogen, right? So that's affecting our heart, cardiovascular risk. It's also affecting our bone health. Remember that once the estrogen declines, right, we have a rapid loss of bone density, bone mass. And so it's really, really important that we understand that. So reduced estrogen can lead to decreased bone density, increasing the risk of osteoporosis. And so this study indicated that premenopausal South Asian women might be more prone to osteoporosis later in life compared to their white counterparts. So that's also really, really important, is that if we're living longer in our postmenopausal years, right, we have to worry about that bone density and preventing osteoporosis in our later lives. Also, mental health, right? So the menopausal transition is associated with the mood swings, depression, anxiety. And because of a lot of the cultural stigmas that we have and the lack of awareness, women may not seek out therapy, right? Because the community doesn't talk about it. And, women may think like there's, oh, well, what are people going to say? And I think that a lot of times we live worrying so much about what other people are going to say. But what we have to understand is that nobody cares, right? They don't care. Nobody cares about what's going on with you. They care about what's going on with them. So, if you are experiencing mental illness or having mental health challenges, you really need to seek out a therapist that can help you with those and not allow cultural stigmas and the lack of awareness exacerbate these issues that remain unresolved. Also, it's important for us to understand type 2 diabetes. This is so common in Southeast Asians, right? We know that South Asian women exhibit a disproportionately higher prevalence of type 2 diabetes. And is in that masala study, right? So these are the two studies that I've been talking about. I've been talking about that masala study and this other study that was just published in Climacteric in March of 2025. But they noted in that masala study that South Asians have a 27% prevalence of diabetes, significantly higher than the 8% observed in non-Hispanic white individuals. So this elevated risk persists even at lower body mass indices. And so I was listening to a webinar last night, and the woman that is in charge of that masala study, she was saying that perhaps it has to do with the beta cells in the pancreas, and perhaps they're not working as well as maybe somebody that's not Southeast Asian. Maybe they and that could be the reason why we have a higher incidence of this type 2 diabetes. This elevated risk, like I said, happens even with individuals that have low BMIs, indicating that BMI thresholds may not be adequate for assessing diabetes risk. So, what is something that practitioners look at when they have you come in for your annual exam, right? We look at the hemoglobin A1C, which is a marker that tells us what the blood sugars have been running the last 3 months. And so that is something that often physicians will take a look at to see what your risk of this diabetes. And of course, your fasting glucose is also going to give us an indication of what your blood sugars and what you're at risk at, and if you are starting to develop diabetes or not. Basically, when you compare Southeast Asian women to Caucasian women, we know that, Southeast Asian women are more likely to develop type 2 diabetes at a younger age and a lower BMI, suggesting that, the standard screening guidelines may not be enough for early detection for us in our communities. The risk of cardiovascular disease, of course, is higher among Southeast Asian women, and things such as high blood pressure and atherosclerosis tend to present earlier and more aggressively. Cholesterol profiles, so that's really important to understand as well, is that, high cholesterol patterns differ among Southeast Asian women, exhibiting a higher lipoprotein A. Remember, we said that was one of those things that contributes to an increased cardiovascular risk, right? So those are all important things to understand. we know that the Masala study really is a pivotal longitudinal research that focuses on Southeast Asian Americans, specifically from Bangladesh, Sri Lanka, Nepal, and these findings are relevant to Southeast Asian women. It was launched in 2010, and it now has 2,300 participants from San Francisco, Chicago, and New York City, including people from that are Indian, Pakistani, Bengali in heritage, and are trying. They're now so the main researcher. Her name is Alka Kanaya, and her colleagues are trying to piece together how these biological risk factors interact with the non-biological ones. So she says that there's a lot of social, behavioral, socioeconomic differences that are going to explain the majority of the risk, right? So we're trying to figure out why we have an increased risk in cardiovascular disease. That's really, really important to know and understand. So Southeast Asians make up a quarter of the world's population, but account for 60% of heart disease. And that is from an article published in Circulation, a journal article. But I thought that was just mind blowing, right? So 60% of heart disease cases in the world. I mean, that's crazy, but that's what's happening. Risk factors for this cardiometabolic disease in Southeast Asians, right, is stress, sedentary lifestyle, less lean muscle mass, and more fat in the organs. We're talking about this visceral fat, which is not good fat that surrounds our organs. And it starts at a younger age for Southeast Asians. Different body composition, which is a risk factor for metabolic syndrome. And and I talked a little bit about this before, but, is this genetic or biologic? And I said 10 to 15%. It looks like here it's actually 15%. So 15% is the genetics, right? So the genetic makeup of us is what is pushing us toward this cardiovascular disease. But, what's going to help is exercise. Exercise is always super, super important. And it's really important to keep moving our bodies, right? We know that sleep is also very important. About 7 to 8 hours a day is really what's recommended. Decreasing our fat intake, decreasing red meat is going to be really important, increasing perhaps legumes and lentils and fresh fruits and berries and a low-fat diet, cutting down on refined carbs and high fat. Nuts and lean protein are going to be super important. Increasing fiber, right? That's also going to be important in our diet. Increasing physical activity. So when we talk about physical activity, we're talking about like brisk movement. There was also a study that was done that noted that restorative yoga actually helped to bring down blood sugar levels, which I thought was totally fascinating. That was a research that was done again by that woman, Alka Kanaya, that is running this Masala study. They also talk about building muscle mass, right? You build the muscle mass to increase the insulin sensitivity and to prevent the diabetes. So these are some things that we can do to help prevent that risk, right? So all of these things that I just mentioned about sleep and diet and physical activity and about resistance exercises, all of these things are going to be helpful for us to live our best lives and to decrease our risk of developing all these cardiometabolic diseases that can happen to us at a younger age, but also realizing that for women, once they hit menopause and lose the protective effects of estrogen, right, those chronic diseases can become worse. So it's really important for us to go and be evaluated, go for our annual exams, get our checkups, all of that, and decide, hormone replacement. Is that something for you? Is it not for you, right? Is it going to help you in making any of these conditions worse, or is it going to make it better? All of those things are something that you need to talk to about with your doctor and see what's right for you. So I don't want to finish this podcast without mentioning the role of epigenetics and how did we get here in the first place, right? Why is it that Southeast Asians have this horrible, as my son calls it, these horrible genetics? And what happened? What caused this? And I think that it's important to realize the role of epigenetics. So what is epigenetics? It refers to the change in gene expression without alteration in the DNA sequence, influenced by environmental factors. And in the context of Southeast Asian populations, right, what happened? So we had historical famines that happened back when, at the time of colonialism, right? So what happened is that we have Southeast Asia that was colonized by the British, and the colonial history of Southeast Asia had a lasting impact on health implications. So there was forced starvation. Policies during colonial rule led to repeated famines, causing widespread malnutrition. And these events not only had immediate health consequences, but also induced long-term epigenetic changes affecting our metabolic health, right? The compounded effects of historical trauma and socioeconomic challenges contribute to the current health disparities observed within the Southeast Asians, right? And what happens with starvation? So, starvation adaptation, the historical exposure to famines that were created by the British, particularly during the colonial times, may have led to the adaptations of favoring energy conservation, right? So while beneficial during the time of scarcity, right, while we were experiencing famine, these adaptations predispose individuals to metabolic disorders in environments with caloric abundance. So basically, what's the, why am I saying this? What happens now? So we see these effects. We see the effects of the forced starvation, the malnutrition, the famine that happened way back when to our ancestors. We see them now in our own genes. And that's why there's been a lot of study to show that that's why we have this increased cardiovascular risk. And so this transgenerational effects, so these epigenetic changes result from ancestral malnutrition, have been passed down, affecting the current generation's susceptibility to type 2 diabetes and cardiovascular disease. So that's why it is so important to understand our history and to know how we got here in the first place and what are the things that we can do about it, right? We can't change our history, but we can change our future. And so that starts by going and taking care of us, taking care of our health, making exercise a part of our daily routine, watching what we eat, looking at our diet, what are we doing to prevent these chronic diseases from happening in our lives, right? So some of the barriers, of course, to care is that, cultural perceptions of how we see diet and exercise is really important, right? There's a lot of taboo and stigma in the Southeast Asian culture. And, we don't talk about reproduction. We don't really talk about periods. We don't talk about menopause, right? It's considered a taboo topic. And so that's why it's really important to have these discussions, talk about what's happening to our bodies so that we can take preventative action. Healthcare access, we also know that studies have shown that Southeast Asian women are less likely to seek medical help for menopausal symptoms due to cultural beliefs and lack of awareness. And of course, limited access to culturally competent healthcare professionals affects the quality of care, right? So if you go to your doctor and they don't understand that you're Southeast Asian, you have this increased risk of cardiovascular disease, dyslipidemia, type 2 diabetes, they may, and you're, perhaps your normal weight and, you have normal blood pressure and all this stuff, they may just dismiss you and think that you're worrying for nothing. Whereas somebody that is more culturally aware of your background and your history, they may take it more seriously and, advise you on dietary changes or also on, lifestyle changes and exercise and all of that stuff. So cultural competence is huge, right? Healthcare providers, it would be great if all healthcare providers could receive some type of cultural understanding and the nuances for different communities, right? Each community has their own nuance. So it'd be fantastic if we could all learn from each other. That would be really important. Of course, language services are really important. If you're in a doctor's office, you don't understand what the doctor is saying, that's going to be a huge hindrance, right? So what are you going to do? You're going to find somebody that can perhaps translate for you. But now in most practices, you can get like a translator line where you can get somebody to translate for you. Also, it's really important to get the community, right? So we are all social beings. If we know that we are suffering in menopause or perimenopause, or if we have all these, risk factors for heart disease and type 2 diabetes and stuff like that, really important to get the community engaged so that you can all come together. And maybe you can have some community-based programs that can raise awareness and provide support for women undergoing perimenopause, encourage open discussions about menopause within the community, maybe have like a community yoga or community exercise programs, right? To get everyone into being more conscientious about our diets and our health and increase awareness. Really, early intervention is key. It's key with anything in life, but recognizing the unique risk profiles of our community are super important to prevent these heart attacks that are happening earlier and earlier within our communities, right? And that's because we don't understand or we don't know that we have this increased risk for cardiovascular disease. And it allows for targeted interventions and, potentially reducing the morbidity and mortality, right? So death and disease that affects communities, it can potentially help with that. We can also ask, our healthcare providers to be more culturally sensitive, especially, I would say, in areas where you have a high proportion of Southeast Asians. Really important to be aware of what their risk factors are and, informing public health policies. But really, I think it's engaging the community and getting the community support in really trying to make a change in the way that we live our lives in terms of our diet, our exercise, and just bringing about public awareness, I really think is key. So that was a lot. I hope you learned a lot. I know I learned a lot for sure in doing the research for this podcast episode. I was like, holy cow, I didn't realize that number just sticks with me, right? We are a quarter of the world's population, but carry 60% of the cardiovascular burden. That's a big number. So really important for us to take charge of our lives, take charge of our health, and incorporate exercise and wellness into our daily lives. So that's what I'm going to leave you with. And well, I am done here, and it's been real and really intimate. Of course, is not meant to be any type of medical advice. So I invite all of you to go look into the Masala study, look at, there's a lot of publications on that. They even have a drama. I think it's called The Brown Heart. It talks about the health and risk factors in the South Asian community for heart disease and how it's really killing our community. So really important for you to learn and understand your risk factors. And if you're not Southeast Asian and you're listening to this podcast, now you know something about the South Asian community and what their risk factors are. And then perhaps you can think of ways to help them and talk about their risk factors. So this is definitely a podcast for everyone. And I hope that you learned as much as I did doing the research on this. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.